Today's topic is career scope and its relevance when it comes to dietetics nutrition. Along with me, I have the head of the department, Dr. Anuradha Mukherjee, who looks after the entire dietetics nutrition, which is a very flourishing subject. Anuradha, my first question to you is, what is the scope of dietetics nutrition as a subject, as a career in the next 5 to 10 years? What do you see India is going to do? And how relevant it is with the lifestyle diseases that we find amongst youngsters? How relevant it is to them?
It's a very proud moment for me to speak on nutrition and dietetics today, sitting here. And the question which sir you're asking me is extremely relevant because nutrition is related to food, and food is our right, not a choice. So what is pertinent in today's world, keeping an eye on the lifestyle diseases, as you're speaking on like hypertension, diabetes and cardiac issues. So all these things are all related to food and the dietary pattern. So if we consider food to be our right, then there's a mistake between the choices, because the choices has to be willful, and depending on that we can keep an eye and maybe prevent and manage our diseases well, and we can also spread this awareness to the youngsters, starting that into a practice right at home, and then of course as a career objective, as a cause, we can have more awareness, because nutrition is not just a science, but it is a particular slogan which should be kept in mind and to everyone, so that we can prevent diseases and keep ourselves into well-being.
Thank you, Doctor. I want to understand from you, other than hospitals or clinics, where is a dietitian or a dietetics nutrition professional is exposed to? What are the different careers other than working in a hospital or a clinic?
Very pertinent and relevant question, sir, because dietetics there is two terms which are often used, like dietitian and nutritionist, and we are often confused with the terminology, because they are more or less they are related to something to do with like food and food industry. So to say in a brief manner, dietitian is someone who is academically having more certificates and trained an individual, rather than nutritionist who could be a person with I won't say that without the knowledge of nutrition, but of course not. It is not requiring that standardized protocol to become a nutritionist, whereas we can do with dietitian. So keeping this two intact, we have a clinical nutritionist or a clinical dietitian who works in a clinical setup. There can be food formulator or food development industries, where like pharma companies, where they can be a very important role they can play. And of course, they can be like content creator. A lot of nutrition blogs are coming up these days, and that should be authentic enough, coming from a proper academician, because everybody cannot be a food blogger or a nutrition blogger. So we need to have a proper knowledge to it. And of course, you can be a community level nutritionist, a public health nutritionist, and moreover, we can have ourselves placed as an academician, as I am writing in. So we have a lot of opportunities being elected.
Fantastic, Dr. Mukherjee. I just want to think, our department is a very young department. What is very different about this department, which is very unique compared to any other institutions?
Well, sir, it's a very good opportunity that I get to speak on. Yes, we stand up high as in the course of dietetics and nutrition, in terms that our integrity lies in practical experience to do with the hospitals, because dietetics is a subject which requires a lot of practical exposure, and since we are tied up with a lot of hospitals, we get a clinical exposure to it, and moreover we have we give personal trainings and concentrating on the personal grooming, which is essentially important to be a dietitian. And also we have a lot of innovations and researches into mind, and for that reason we keep up annually a conference where we have global and national connects, and our students are nearby local people, and children from different schools and colleges gets an exposure to learn what exactly is required in terms of dietetics. And this particular awareness generating program keeps on coming to us, and this helps them in terms of getting researches done properly. They have an eye of innovations also. So this actually makes into a differentiation between our course and than the others, and this makes them clinically very market savvy. Along with, they are ready with the academics by getting into different speakers and different academicians who come in and around India and around.
So what do you think? How industry relevant is your curriculum? Or do you actually follow the university curriculum, or there is something extra that we do here?
Sir, honestly speaking, we are following the curriculum which is given, but I have devised in the way which makes the student industry ready. So that there are certain points where we get the students into internships and clinical exposures, which are not only for their building their clinical eye, but also to get into the right ambience where actually they'll be getting an exposure to what the corporate world, the grooming, the type of discipline they are requiring when they're going outside to the hospitals they're working, and also most importantly their own comfort area they're given out, and they are to work from the areas where they might not be comfortable. So the industry demands several requisites which they are getting into once they are part of the this internships, and finally when they go for their placements they are absolutely ready and they get into high acknowledgement.
Is there any particular criteria or prerequisite that the student needs to do joining this program? That's one part of it. Second is, when you talk about, there are two programs in it. One is BSc Dietetics Nutrition and MSc. I'm sure that takes a path to the doctor, becoming a doctor, doctorate, people can become medical practitioners. I want to understand that what is the scope that you have laid for your students for the future? And is there any probability that people say, today we talk about hotel management, we talk about other programs like hospital management. What is the scope? Is there any opportunity where actually they can come in and do a master's with us and gain a lot of knowledge and coupled knowledge which will help in the industry?
Sir, surely I would say, because this is basically now we have a choice-based curriculum. So and especially subjects like whatever is dealt up in the hospital or in the food industry, it's something related to the dietetics, because whether it's a mental well-being or a physical well-being, or maybe something to do with the food, we always need to be cautious, because food safety and food relevance depends on the knowledge of dietetics. So, and since already we are having different disciplines like hotel management, hospital management, to name with, there are even more like yoga and other disciplines where dietetics or nutrition is a part as a subject. So why not? They can of course come and be a part of our curriculum, because we have BSc and MSc both, but now more specifically we are evolving better, because we require more people to join in the course, because it's not previously it was a customized or a personalized nutrition, but now it is becoming like a precision nutrition, where very important to know the genetic coding and to do with the specialization, and once we get to know the this metabolomics, this omics study, we can directly target to the particular disease and we can get into the reversal. So that requires a huge manpower, and to support it we require a good number of students.
Thank you.
This is very important.
Thank you, Dr. Mukherjee. Just last question. Today we talk about NSHM 2.0. What's your vision for NSHM 2.0 when it is into your department?
Sir, I'm very hopeful that like nutrition should not be a choice for subjects for the students to come and opt for it. I think every portal, whether it is having nutrition or it is not a part of nutrition, everybody at least should come up with a vision of a proper nutrition, because these are the basics. So the food is the basic of everyone. So let us target in such a way that nutrition is with everyone in the mind and the body, and we can reverse the diseases hand in hand going with the medical treatment.
No, I just want to interrupt, ma'am.
Yes.
I'm talking of NSHM 2.0 talks about IQ or Industry Inside Institution. How is your department looking at it?
Sir, we are absolutely prepared as the new dimensions that I was just discussing about the precision nutrition and this, like more targeted nutrition. So it's something very new, and it's based on more training and imparting of new, like treatment protocols. So once they know, once they come to us, we will be able to impart, and we can generate, like some good academicians along with skill-based individuals, dietitians, so that they can, rock the world with their new therapies and new innovations. I think people with this knowledge will no longer will be like talking about, whether it's a science, whether it's a tradition, but they will understand that real element of this nutrition being into practice. And once as you're talking about, some new innovations are required in the coming years and the future. So I think this particular course will boom, and they will be a mandate for everyone, all the healthcare industry to flourish in a better way, because once they know it, once they train them, then only they'll be able to apply and reverse the
Just,
course.
I think we missed out one thing, is that what is the minimum eligibility criteria to take up your courses?
Sir, for graduation, the eligibility is like the student need to be a class 12 pass with a proper, good aggregate. Of course, science is preferable, but it's not that only science children can be a part of our
So
course.
humanity students can also.
Yes, everyone, because we
What
start.
about masters?
Masters also the same thing. They need to be a graduate, and then they can opt for it.
Any stream?
Any stream they can opt for it, because we have the subjects lined up in such a way that once they come here, we give them basics in the first semesters, and then on we get into the like the deeper in thoughts and deeper in the academics, and they are skilled also in that way, and they can be a good dietitian.
Thank you so much, Dr. Mukherjee, for your time.
Thank you so
and
much.
Wish to continue our discussion later.
Thank you so much.